Hi, I'm Nick Powell, City Hall Bureau Chief with City and State. Joining me on today's City and State TV is Dr. Ramanthan Raju. He's the President and CEO of the New York City Health and Hospitals Corporation. Thank you for joining us today, Dr. Raju.
Thank you very much, Nick, for having me here. It's
Absolutely.
a pleasure.
So I wanted to start off, you're returning to HHC after a 2-year stint at the helm of the Chicago public hospital system. So I'm wondering, did your experience in Chicago change any perceptions you may have had about the New York City system, either for better or for worse, and how would you compare the two if you had to?
I was in New York for about 30 years before I went to Chicago. This analogy kind of rhymes with me. When you are in your home, you look at your home, you live there for many years, and you look at the wall, you could look at the ceiling is a little cracked, it's got a little paint peeling off, you look at outside, it doesn't look as good. Then you always say, my house is getting old, it's not the right thing. Then you go outside the house, and then you start looking at the house from outside. Then it says, something, my home is definitely better than the neighbor's home, or it looks better. My portico looks better, my grass looks greener. So sometimes to appreciate a system, you need to go outside the system.
Sure. Then
you see what great the system is. So that is the kind of revelation I got when I coming back. I was amazed at the New York City Health and Hospital Corporation for two major reasons. One was it is the sheer size of it, right? There are not many public health system in the country which has got this big clientele and the systems to take care of it. It's not as well integrated as New York City is. Second part of it is that the cultural competency and the diversity is something very striking. It is like, this is probably one of the systems in which you speak more than 180 different languages, and you have people coming from all over the world to be in there. If anybody walks into our system from any part of the world, and I'm pretty sure that somebody in my system would be from that part of the world and probably speaking their language. So that is something tremendously, underappreciated when I was in New York City. So when I come back, I appreciate that tremendously. So I always used to say this, now in New York City, Health and Hospital Corporation, our patients look like us and we look like our patients. So not many healthcare systems in the country can claim that as a part of it. So I come back with a great appreciation for the system, more than what I had when I was here as a part of it.
Sure. Now, in your previous stint at HHC, you oversaw a cost-cutting program to deal with the rising deficits of the system. Now, currently, how would you characterize the system's financial state, even after those cost-cutting programs that you instituted?
Let me put a national perspective. There's no public hospital system in the country which has always been red. No system is on black, ever. It has got to do with the fact the clientele the public hospital systems really deal with. Again, after being a doctor, I'm also got my MBA. If you want to succeed in a market, you control the market. In a public systems, you do not control the market. Your market is the market nobody else wants, right? So if you are really going to take care of more uninsured and undocumented and underinsured people in the system will always be in red, which is inevitable. But normally what happens is the governments usually come to the rescue to take care of people and help the public systems to take care of people and compensate them for that. That method of compensation, what we call is a disproportionate share of money, which is given to the public systems to take care of uninsured people, it is kind of going away. It's kind of slowly getting smaller and smaller, and by 2020 is going to reach a stage where it's going to be very difficult. It is based on the premise that in the Affordable Care Act basically gives a lot of people insurance. And so once people have insurance, then you don't really need to support the public hospitals because there will not be anybody uninsured. But there is a two major group of people, actually three major group of people will be uninsured in spite of the ACA. One is undocumented immigrants because they can't be a part of Affordable Care Act, even if they want to be. Even if they want to pay, they can't buy products in the insurance market. The second part of it is people who can't afford to buy the premium because the premiums are very high and the penalty is very low. If I am really living paycheck to paycheck, I would rather pay the penalty than pay the premium because premium is about 5 times more than the penalty, right? Those are things. And then there is a group of people whom we call in the healthcare industry as young invincibles. These are the people who are younger. They don't believe that they need healthcare. They will never need one. That's what they feel about it. And they will not choose to buy healthcare unless the healthcare is given to them as a part of the employer's plan. Otherwise, they don't seek out and get healthcare. So when these three groups of people get sick, they will probably be uninsured in spite of the fact that they have an opportunity to do that. So in a public system which basically takes care of everybody, doesn't turn anybody away, government need to support the system, take care of this group of people.
Right.
But under the Affordable Care Act, unfortunately, the DISH dollars are going to go down, and that is going to put a huge financial problem for us. And naturally, Health and Hospital Corporation looking at a large financial deficit because we continue to provide the mission of not turning anyone away, but at the same time, we need the money which comes to support this is going to slowly disappear. Right. So that is the status of financial situation in health and hospital today. But we are looking at other avenues by which you are able to compensate and still carry out our mission at the same time, able to keep the system financially sustainable.
And one of those, I would assume, would be the Medicaid waiver that is coming in. Do you have any idea, by the way, how much of that waiver will be coming through to the New York City system?
We will be a major player in the Medicaid waiver because of multiple reasons. One, we are big. 1 out of every 6 New Yorkers is our patient. So we are a big healthcare delivery system for New Yorkers. And second thing is the things which are required under waiver, like what we do with ambulatory care, preventive care, community-based care. We have been doing it even before this was popular, even before it was a fashionable thing to do. As other hospital systems are building more profit-oriented service lines, like heart centers and spine centers and stroke centers, we were mostly into primary care, preventive care. We've done more screening mammographies than any other system in New York City. We have done more screening colonoscopies than anybody else in the system. We have done more HIV testing for the population than anybody else. We have done more mammographies, right? We have done more immunizations to people. So this is not new to us. So we understand how this community-based preventive population medicine plays out. We have an expertise on that. We are a leader in it, and we also have a leg up on that. But we need to understand that DISRIP is, and the waiver is not a grant program. They're not going to give you money just because I've been doing it for many years and I'm good at it. It is purely based on the projects I select and how effective I am with the projects to change the healthcare status of the populations I choose to serve in the project. So it's not a grant. We need to earn the money every time. So it's very difficult to predict how much of the money will come in. Sure. It depends on how effective our products are, how our projects are, and how effectively we are able to manage our partners, and how effectively we are able to transform the health of the individuals who is under our what we call as a PPS, right? That is, we are the lead PPS, and who are all connected to us. How do we do that? So I look at it as a great challenge and a great opportunity. The opportunity is that it is an opportunity to be an active player, and what we have been doing it for many years, we're able to do this in a much more bigger scale. The challenges are that we need to manage our partners, choose right projects, and really change the healthcare delivery system in New York City. And most importantly, we need to show results. The results are what is going to give you the money.
Now, I want to talk for a second about the undocumented population. Obviously it's tough from your position. It's not like you can necessarily control who hospitals accept and who they see as patients. I'm wondering if the community health centers that the city have can kind of help fill in those gaps where in terms of kind of serving that population more directly, or are there other means within the system to help alleviate that problem?
There are every system and every federally qualified health center in New York City serves undocumented immigrants in our society. But New York City Health and Hospital Corporation has got a large portion of them. They seek care and get care in New York City Health and Hospital Corporation. It has got to do with the fact that that's our mission, that we will serve everybody irrespective of the economic status, irrespective of their race, color, ethnicity, and immigration status. So that is a fundamental mission of the health and hospital system. And our mission is not for sale. We are not going to move away from it. The undocumented, uninsured problem will be a bigger problem, because as we are able to get insurance status to the people who are, because of ACA, we need to take care of this group of people who are absolutely essential to take care of it. So we have to really work together to make sure that they stay healthy. Because in an urban society like ours, our health depends on each other. Your health depends on me, my health depends on you, sure. Right? If you are in a crowded subway or you are in a restaurant, right, the person who is next to you or the person who cooks your food, if that person is sick, you're going home sick.
Right.
So there is nothing called these undocumented immigrants, they will be on one side of the street, they will not be affected. No, they are a part and parcel of our society, and they are economically, they work hard, they contribute to society. So it is a responsibility to keep them healthier. So I think we play a huge part in taking care of the undocumented immigrants. They are most welcome in our institutions because we do not discriminate against them. We welcome them. We want them to get connected to us. We want them to stay healthy, because we understand that the New York City health depends on health of everybody, not just health of insured population.
Right.
So I think that is the way we are moving into that, and we will be closely working with the other institutions to provide health care to the uninsured, undocumented people.
Now, I wanted to shift gears a little bit and talk about this Hurricane Sandy and some of the damage that was inflicted on the hospitals. What is HHC doing to kind of harden the critical infrastructure at the hospitals that are perhaps closer to the coastline, or even, I guess just in proximity to water that could be damaged in another natural event like Sandy?
Sure. Health and hospitals suffered a lot during Sandy. We had we had to close down clinical services and operational services in 2 of our hospitals. And one of our hospital systems did not have electricity for a considerable amount of time. But what amazes me is the resiliency of the healthcare workers in our system. There are not many examples in which a hospital system gets completely wiped out. A hospital get wiped out by a Sandy. So it's like Katrina happened to Charity Hospital in New Orleans. It never reopened again. Where we are able to reopen this in a short period of time, that speaks to the commitment, the resiliency of the health workforce in the Health and Hospital Corporation. Since Sandy, it created not only a huge problem for us, it also created a problem for the communities we serve. So basically what we have done was, we have done some critical structure improvement. We moved the critical systems to a higher floor above the flood level. We put some temporary flood gates, right, as a part of it. We have done quite a few things, repairs, to make this work. We are working very closely with the FEMA to pay for those repairs, as well as to have some permanent mitigation effort into this. So we have some plans we submitted to FEMA, and we are in a very close conversations with them, and they are very, very helpful, and hopefully we'll be able to get them the capital dollars to be able to hardwire and harden our facilities, so that if another hurricane like Sandy hits us, we will be able to function, because we need to function for the benefit of the communities, because the community depends on us, and most important, New York City needs us.
Sure. Now, I wanted to wrap up by just asking you, 4 years from now, when Mayor de Blasio is up for re-election, what do you hope is the legacy that you can, leave for him to point to and say, this is where we made real improvements to the health and hospital system? What vision do you have for the next 4 years?
My vision is in 4 years, every New Yorker will have geographically convenient access to healthcare all around the city. There will not be any healthcare deserts where the people do not get healthcare or cannot get access to healthcare. We will create access points which are geographically convenient to the people so that they're able to get adequate healthcare. That will be the legacy.
All right. Dr. Ram Raju, the President and CEO of the Health and Hospitals Corporation of New York City, thank you for joining us today.
Thank you, Nick. Thank you for the opportunity.
Absolutely.
Appreciate it.